Have you ever stopped to think about how a surgeon can do these incredibly detailed repairs deep inside your body, all through a tiny little hole? Well, today we're going to crack open that high-tech surgical toolkit to find out. We're talking about the amazing instruments they use to sew, staple, and rebuild us from the inside out.
And really, this is the core of the problem, right? It's like building a ship in a bottle. Surgeons are doing these super delicate tasks in a tiny, confined space. They're usually looking at a 2D screen using these long instruments that give them almost no sense of touch. But of course, the stakes are infinitely higher. So how on earth do they pull it off?
Well, they do it with a toolkit full of some of the most precise instruments you can imagine. Let's start with the tools that are all about the fine art of surgical sewing, also known as suturing.
Okay, so the absolute cornerstone of all this laparoscopic sewing is the needle holder. You can basically think of these as the surgeon's super precise, long-distance hands. They're the foundational tool that makes everything else even possible.
And every single feature on here is a direct solution to a problem. Those long, rotatable shafts, they let the surgeon get to the target from just the right angle. The ergonomic handles, they're all about reducing fatigue during long procedures. And the tungsten carbide jaws, man, they give an absolutely rock-solid grip on that tiny needle, which is so crucial when you can't actually use your own fingers.
So while traditional suturing is a real craft, the next tool we're looking at brings in some pretty clever automation. The endo-stitch device. This thing was specifically made to simplify one of the absolute hardest parts of the procedure and to really flatten that steep learning curve for surgeons.
The genius of it is just how simple it is. The surgeon just gets the device in position. One click, and the needle passes right through the tissue. A second click, and boom, it retrieves it on the other side, perfectly positioned. This simple, repeatable little action makes sewing way faster and so much easier to master.
So the endo stitch brings consistency, which is great. But what if you could get rid of one of the most time-consuming steps altogether? Well, that's where barbed sutures come in. And this is a true game changer.
This is just fantastic. Seriously, imagine a thread that's covered in these tiny one-way barbs. As the surgeon pulls it through the tissue, those barbs just anchor themselves, holding everything together without a single knot. Not only does this save a massive amount of time, it also spreads the tension out evenly along the whole closure, which can actually lead to better healing. It's brilliant.
So, we've seen the precision and really the artistry of suturing. But in surgery, sometimes what you need most isn't artistry, it's pure speed and rock-solid consistency. And that requires a completely different approach and a totally different part of the toolkit, stapling.
I'm not kidding, the development of surgical staplers absolutely revolutionized what was possible in minimally invasive surgery. These devices took procedures that used to be incredibly long and complex and made them way faster and a whole lot safer.
So what are they exactly? At their core, surgical staplers fire these really precise, uniform rows of tiny titanium staples. This technology just transformed major operations, things like removing parts of a lung or the bowel, by creating these super secure closures in just a fraction of the time it would take to do by hand. And these tools are highly specialized. A linear stapler, for example, lays down multiple rows of staples, and a blade cuts right between them at the same time, perfect for something like a sleeve gastrectomy. But a circular stapler, on the other hand, does something amazing. It connects two hollow ends of an organ together, creating this secure, circular seal that is absolutely vital in colorectal surgery.
Now, not every tool is about closing things up or connecting tissue. Sometimes the job is just to secure something in place, and for that we have fixation tacks. You can think of them as miniature, high-tech screws for a really common procedure, hernia repair.
So picture this. In a minimally invasive hernia repair, a surgeon places a surgical mesh over a weak spot in the abdominal wall. The next step is crucial, making sure that mesh stays exactly where it needs to be. These tiny little helical tacks are fired right through the laparoscope to anchor the mesh securely. It's a quick, reliable fixation that's absolutely essential for a successful, long-lasting repair.
Okay, so we've seen some incredibly powerful and sophisticated tools, but you know what they say, with great power comes great responsibility. The real skill of the surgeon isn't just in using these tools, it's in knowing how to use them with absolute precision and safety.
And it all boils down to this one core principle. Safety is paramount. Every single action, every stitch, every staple, it all has profound implications for the patient. There's no room for error.
This one is just non-negotiable, especially with the staplers. The tissues have to be perfectly, and I mean perfectly aligned before that device is fired. A misfire could be catastrophic, maybe damaging nearby structures or creating a weak closure that could lead to really serious complications down the road.
Now, this rule is a little more subtle, but it's just as important. When you're placing a suture, if you pull it too tight, you can actually cut off the blood supply to the very tissue you're trying to heal. That condition is called ischemia, and it can cause the tissue to die and the whole repair to fail days later. It's a really delicate balance of science and art.
And finally, a specific rule for our no-knot wonders, those barbed sutures. You have to remember, they're a one-way street. Once they're pulled through the tissue and those little barbs engage, you can't pull them back out. If a correction is needed, the suture has to be very carefully cut. It just demands forethought and precision with every single pass.
So when we look back at this whole toolkit, what we're really seeing is a story of ingenuity. You've got tools for remote precision, like the needle holders, tools for consistency, like the endo stitch, tools for knotless efficiency, like barbed sutures, and of course tools for pure speed, like the staplers. Each one is a brilliant solution to a unique challenge of operating inside the human body. This whole journey through the surgical toolkit really shows just how far we've come. But it leaves us with this really fascinating question. As these tools get even smarter, and they are, with robotics, AI, new materials, what does the operating room of tomorrow even look like? The possibilities are just incredible to think about. Thanks for exploring this with me.